The Ministry of Health has announced plans to reintegrate HIV, malaria, and tuberculosis programs into regular healthcare services as a key step to bridging the funding gap after the United States temporarily halted funding for various nations. Our reporter Florence Simiyu provides more insight to that story.
Health Cabinet Secretary Deborah Barasa has emphasized that the three key programs will be supported through the Taifa Care Initiative. The announcement follows a decision by USAID to place all its international employees on unpaid leave starting this Friday.
This is becoming a stark reality that we really need to move towards that, so that we don't have HIV, TB programs standing in silos, but we have them integrated. And this is again part of the initiative to have one plan, one M&E, one budget. And you see, by that we'll be able to secure so many resources that have been falling through the cracks over time immemorial because of fragmentation of various programs within the ministry.
This means that the healthcare service that were previously free under these three programs may now require patients to contribute through Taifa Care payments. However, some fear this move could impact the Social Health Authority, which has not yet collected enough funds, while the national health budget remains insufficient. Kenya is among major beneficiaries of this aid, receiving approximately $1.4 million annually through USAID, equivalent to 60 billion Kenyan shillings. These funds are crucial for health projects. Elsewhere, the Anglican Church of Kenya Archbishop Jackson Ole Sapit says the church supports the move by the United States of America to freeze foreign aid, saying it's time for African leaders to seek internal solutions in addressing problems facing the continent.
Trump disruption of the rest of the world must be a wake-up call for us to be able to think. Every other economy grew, not in easy times, but when they were faced by a crisis, they think deeper.
Archbishop Sapit, who was speaking at St. Paul's College, Limuru, claimed that the foreign aid, especially from United States and Europe, has in some instances been channeled to personal use instead of the intended purpose.
The other big problem to our development agenda is greed, and particularly to us leaders when, we take it away from people. And
the ministry has also acknowledged a shortage of cancer drugs in public health facilities, linking this issue to county debts owed by the Kenya Medical Supplies Authority, which has hindered the supply of these drugs from the manufacturers.
We are in discussion with Social Health Authority so that when KEMSA supplies a medicine to a county, instead of us waiting for the county to pay KEMSA, when SHA is paying the counties, the portion for pharmaceuticals should go direct to KEMSA, so circumventing that process.
The ministry has pledged to collaborate with both public and private health facilities to extend the distribution network for cancer drugs and provide financial support for costly cancer treatments. Reporting for Tandao News Outlook at 1, I'm Florence Simiyu.